While we're talking about 2020, obviously mentioned up front, Julian Castro left the race today. I have to say that he left the race. I was more of a fan of him after he left the race than when he entered.
Because I don't think any of us were especially big fans of his before he entered the race. Yeah.
Right. Now, to be fair, part of that was because, was it his brother that spoke at the 2012 Democratic Convention? I think it was his brother, right?
Yeah.
Okay.
No, it was Julian Castro.
It was Julian.
Yeah.
That speech that he gave, I was not happy with. There was a lot of like, pull yourself up with your bootstraps type of quality. Like, if you are lucky enough to have an abuelita like I did, then you're in good shape. Otherwise, you're SOL. And I found that a little bit problematic. But, you know, he was pushing good policies as a candidate. And I would have much rathered him be further along in the race than someone like Amy Klobuchar, let's say, in terms of bringing in new ideas, telling us what we can't do. Here is Andrew Yang, who has opened the door to what we can do. One of those things is give everybody $1,000 a month and give people who are relying on the social safety net the choice. You can either take what benefits you're getting now, which are more often than not insufficient, and get slightly more on a monthly basis. Of course, relative to everyone else in society, you will not be making up for those deficits that you are dealing with. But it's a theory. And in theory, I don't have a problem with the government handing out money to people on a regular basis, but it should be on top of any other type of services that we're giving now at the very least. And so here he is, Andrew Yang. Oh, the other thing that he has an interesting take on is Medicare for All. Medicare for All is the name of a bill in the Senate introduced by Bernie Sanders. It is also the name of a bill in the House introduced by Pramila Jayapal. Medicare for All is not literally Medicare for all. It is a derivation of what Medicare is. It's closer in many respects to Medicaid for all. But it is a specific bill that has specific benefits that it's offered. There's a specific plan in passing it, a phase-in plan. There's a lot of specifics behind this. All of the funding is not necessarily there, but no bill is introduced with all of its funding. Everybody has a plan to fund it. It's a very specific thing. That is a problem, apparently, for Andrew Yang, because he wants it to mean something different, because apparently he knows how it lands on people's ears. I'm going to play this after, but I'll also play it this way.
And you, sir, you're a pretender.
Here's Andrew Yang on ABC's This Week trying to pretend. I mean, look, if you don't support it, don't support it. Joe Biden doesn't. Pete Buttigieg doesn't. They're pretty explicit about it. Andrew Yang doesn't want to be as explicit about it. I wonder why.
Okay, I want to turn to your healthcare plan, because you've just released a new healthcare plan, and I'm a little bit confused about where you stand. First, I want to play clips from two of your ads where you talk about healthcare.
We need to move towards a Medicare For All system where every American has access to quality and affordable services.
His ideas are a blueprint for a new way forward. A healthcare system with Medicare For All.
But I've looked at your healthcare plan. In fact, I've got it right here. And this plan does not call for Medicare For All. In fact, it doesn't even have a public option. So why the dissonance here?
We need to move towards universal health care that's high quality and nearly cost-free for Americans around the country. But reality is we have millions of Americans who are on private insurance right now, and taking those plans away from them very quickly would be untenable for many, many Americans. To me, the goal of the government has to be to demonstrate that we can outcompete private plans and then push them out of the market over time. And that's what we're proposing.
But I'm confused. Your ad is explicit. Your ad says Medicare for all. Your plan is not Medicare for all. It's not even Medicare for some, because in your plan, there's not even a public option.
Our plan is to expand a universal health care system to all Americans. Medicare for all is not the name of a bill. Medicare for all is universal health care for all Americans.
But Medicare for all is Medicare for all, right? I mean...
Well, our health care plan would be based on Medicare and expanding it over time to more and more Americans. You lower the eligibility age and then you make it widely accessible.
Okay, I didn't see that in your plan, but I want to move forward to the question of your.
Okay, now. I guess Jonathan Carl does not realize that, Medicare for all is Medicare for all. There's actually is an explicit bill. Like, there's a number. I can't remember what it is. 481 or something. I can't remember. In the Senate and the House. There are explicit bills. So he's wrong. Or he's lying. And just listen to, if it even sounds like Medicare for all. On his campaign site, under a heading called Medicare for All, he has controlled the cost of life-saving prescription drugs through negotiating drug prices, using international reference pricing, forced licensing, public manufacturing facilities, and importation. So I don't know exactly. I mean, some of those things work. It's unclear for me on whose behalf he's negotiating. Right? Like, are you negotiating just on the existing Medicare? It's unclear. Number 2, invest in technologies to make health services function efficiently and reduce waste. All right, so get rid of waste in the system. But again, what system are you talking about? Is he saying that, when we invest in technologies, are we going to give those to the hospitals? In other words, are we going to spend tax dollars to make hospitals more efficient to increase their profit margin? How do we get that money back that we invest? How do we get the return on that investment? Then he also says, change the incentive structure by offering flexibility to providers, prioritizing patients over paperwork, and increasing the supply of practitioners. How do we, who does that? How do we increase the supply of practitioners? Do we just roll back regulations saying, just pre-med, you're a doctor? Or how does that work? Through what mechanism do we, or whoever we are, touch the medical service? I mean, the medical industry. We do it in many different ways. We do it through Medicaid. We do it through Medicare. We do it through patenting of drugs, but none of this is specific. 4, shift our focus in educating ourselves in preventative care and end-of-life care options. In other words, wellness. Try and convince people to get more involved in wellness. Great idea. The ACA offered a lot of incentives for that. And guess what? Didn't work. The ACA has a bunch of that stuff. Ensure crucial aspects of well-being, including mental health, care for people with disabilities, HIV, AIDS detection, treatment, reproductive health, maternal care, dental, and vision are addressed and integrated into comprehensive care for the 21st century. Folks, I got to tell you something. That doesn't say anything. How do we ensure that? These are just broad, these aren't even ideas. They're just sort of
Christmas list.
It's not even as specific as a Christmas list. It's what do you want for Christmas? Really good stuff. Anything specific? Yeah, super good stuff. Overtime. I would like to get good stuff for Christmas. And then last is diminish the influence of lobbyists and special interests in the healthcare industry that makes it nearly impossible to draft and pass me. How do we diminish the influence of lobbyists? You cannot diminish the influence of lobbyists. You can only diminish the power to lobby or the potential rewards of lobbying. And the only way you can do that is to cut them out of this business or to cut their revenue so significantly they don't have the ability to pay for lobbyists who will handle anything down the middle. On top of which, on his website, which, of course, I think if anybody who knows this program at all, move away from defensive medicine. Doctors operate under constant threat of malpractice lawsuits. These cases are only decided by a verdict 5% of the time, and when they are, they land in the doctor's favor 80% of the time. Well, the reason why is because 95% of the time, doctors realize or hospitals realize they effed up, and so they settle. Despite the fact that doctors are almost always exonerated, malpractice suits can take years. As a result, doctors prescribe needless procedures and tests to avoid being sued. Look, all this work has already been done. We know that rolling back in malpractice reform didn't do anything for insurance rates or doctors' behaviors. We know that. Check. There's plenty of research in terms of Texas. There's other states. Go back and look at Atul Gawande's seminal piece about 2 different towns in Texas and their Medicare reimbursement rates. The fact of the matter is that doctors prescribe procedures when they own the mechanism to perform those procedures. If I have a hammer and a saw, as opposed to just a screwdriver, then every time somebody comes to see me, I'm going to use those hammers and saws. But there is Andrew Yang. And, when you combine that with, and I'm still stuck on him being on Dave Rubin's show and basically saying, like, this is a way for us to, his freedom dividend back in the day, this is a way for us to eventually get rid of the social welfare state. Because he's going to force people to choose, do you want your $850 worth of benefits a month, or do you want $1,000 worth of benefits a month? When we know that the $850, and these are hypothetical numbers, not his, but mine, is insufficient. And frankly, also, maybe it's insufficient, but at least relative to the context around them, it's a benefit that helps, relatively speaking, right? I mean,
you have to choose between SSDI and Yang Bucks, but you don't have to choose between your mortgage deduction and Yang Bucks.
Right. And here's the bottom line, though, is like the idea that relativity in terms of money is irrelevant seems foolish to me. And I understand UBI has worked in, controlled environments, in limited environments. And I do think there's something to it. And I think it's definitely worth trying. But to use it as a mechanism to roll back the welfare state, if you want to call it that, I think it's very dangerous. I mean, well, but that, I mean, and look, if the guy's not supportive of Medicare for All and just has this sort of like, I don't even know what this plan is. I mean, honestly, I couldn't pull a single thing out of that was substantive in any way. It's all great ideas, but it is like, what do you want for Christmas? Really great stuff. Overtime. Not all at once. I couldn't handle that. It's time to get real, folks. Clown time is over. If you want if you are supportive of Andrew Yang because you perceive him as having progressive ideals, I mean, I can understand if you're a libertarian and you're supportive of Yang some level. I mean, at least it's consistent.
Has anybody asked him in a debate yet, like, what sort of regulations he would put in place to control against prices just going up as a result of everyone having $1,000 more a month?
I mean, that I think, you know, you could ask him the same question about 1 through 5 of these things. Yeah. Like, how do you control the cost of life-saving prescription drugs? Through negotiating drug prices with whom? On whose behalf? Like Medicare? Why wasn't even use the word? Invest in technologies. Like, okay, so the United States government invests in technologies for telehealth and for modernizing who gets the benefit of that? Like, where's the guarantee these hospitals are going to go like, we just saved, whatever it is, $10 million this year on inefficiencies. We should give that back to the patients.
I had a lot of arguments 6 months ago with Yang supporters, and they would always mention, well, he also supports Medicare for All. We now know,
Right.
conclusively he doesn't. And I also mentioned housing stuff, and I'm looking at his housing, and it's all about zoning laws and the sort of anti-NIMBY which is fine, I guess.
Right.
But, that's not going to change landlords from...
Maybe necessary, but insufficient.
Exactly.
Lastly,